In this video, I'm going to talk about calcium deposits in the shoulder, whether or not they're caused by heavy lifting, the common signs to look out for, and treatment options. All evidence-based. This video is for education purposes only and is not medical advice. However, I hope it helps. Let's get started. Hello, my name is Daniel Lawrence. Welcome to the Physio channel. We're about to talk about calcium deposits in the shoulder, known to medical people as calcific tendinopathy. Calcific tendinopathy most frequently occurs in the tendon of a small muscle called the supraspinatus, but it can also occur in other shoulder muscle tendons as well. The supraspinatus is one of 4 rotator cuff muscles of the shoulder. Calcium deposits in the shoulder usually cause pain around this point, which is the greater tuberosity. But calcium deposits can also occur in shoulders with people that have no pain at all, which makes diagnosis difficult. So who is most likely to suffer from this shoulder problem? Well, those with diabetes, hypothyroidism, and frozen shoulder may be at higher risk. It's also common in the 30 to 60 age range and more frequent in women. And according to the research, there is no link between calcific tendinopathy and heavy lifting. Although the exact cause isn't fully known, it may involve poor healing or overuse, which may cause the tendon cells to turn into cartilage-forming cells, which may be due to genetic or metabolic factors, given the increased prevalence among diabetics and those with thyroid issues. Now, if you're watching this and believe you have or have been told your shoulder pain is caused by calcium deposits in your tendons, then you're going to want to know if you'll recover and how long it may take. So let's tackle that question next. Have a look on the screen here. It shows the stages of calcific tendinopathy. Calcific tendinopathy typically goes through 3 stages or 4 phases. During the pre-calcific stage, there is usually no pain. Then, during the calcific stage, which comprises of the calcium formation phase, where deposits may be visible on ultrasound, this is then followed by the reabsorption phase, which is often the most painful phase. This is then followed by the final post-calcific stage, where the pain usually reduces or stops altogether. Now, without any intervention, calcific tendinopathy usually resolves in a number of months. Timeframes can be very varied, but 9 to 12 months is not uncommon. So what are the symptoms to watch out for? Well, pain around the greater tuberosity, also pain at night, and limited shoulder movement. But of course, these are symptoms which are common for many other shoulder conditions. So there's no particular way of detecting calcific tendinopathy without combining it with a scan. An ultrasound scan is typically the best tool to see the calcium deposits. X-rays can show larger calcium deposits, and MRI scans are sometimes used but not always needed. It's important to remember that imaging doesn't always match the symptoms. One of the first things we can do is offer reassurance that this condition often gets better on its own. In terms of pain relief, you could speak to a doctor or pharmacist about some pain relief options. Exercise can improve movement and strength, and at the end of this video, I'll show you 4 exercises that you can try to help your shoulder pain. Education and understanding this condition can also really help with the management. Now, other options exist, especially if the symptoms persist, and these can include shockwave therapy, ultrasound-guided lavage, which is a kind of needling and flushing technique, and possibly steroid injections as well. What about surgery though? Well, surgery is considered usually only after 6 months of failed conservative treatment, and it's not always necessary or better than other options. Now we're getting towards the end of this video. Here's some key points to remember. Many people have calcium in their shoulder tendons without any pain. Pain usually happens when the body reabsorbs the calcium. You can start with simple care, including reassurance, exercise, and pain relief. Imaging may show calcium deposits, and ultrasound is best. Surgery is usually only reserved for persistent cases. Now, earlier in the video, I said I would show you 4 exercises that you can try, so here they are. Exercise number 1 is rowing. Here I'm using a simple resistance band, and I'm making sure I pull my shoulders back as far as I can to get a full range of motion. For the next exercise, I rotate my shoulders out, keeping my elbows by my side. Here I'm using a slightly lighter resistance band, and this helps to open up the shoulders and strengthen those rotator cuff muscles. The third exercise is lateral raises, using a resistance band like this, or using some light dumbbells. And the fourth exercise is brilliant for overall strength and function. It's the shoulder press. You can do both arms together or alternate like this. Perform each of these exercises for 30 seconds, 1 to 3 times per day. Stop any exercises that cause pain or worsen your pain and consult with a professional for more personal and exercise guidance. That's it for this video. Make sure you're subscribed to the Physio channel where you'll find more helpful physiotherapy videos to watch, like and share.